Are your nights sabotaging your health? Discover the 7 crucial signs your body sends you while you sleep, signals you simply can't afford to ignore if you have diabetes. From mysterious sweats to silent whispers from your body, these nighttime cues hold the key to unlocking better diabetes management. Stay tuned to reclaim your nights and safeguard your health. Even at night, managing diabetes is a constant challenge. As a matter of fact, there are specific symptoms that come on during the night that any diabetic needs to be aware of. It's critical to recognize these symptoms in order to take prompt action and ensure restful sleep. As night falls, let's examine the 7 vital indicators that you should never ignore because diabetes never sleeps. 1. Night sweats. Even in cool rooms, heavy perspiration during sleep is a common symptom of night sweats. When it comes to diabetes, these severe perspiration fits may be a warning sign of low blood sugar at night or nocturnal hypoglycemia. This can be caused by a number of factors, including an imbalance in daily meals, intense insulin treatments, specific drugs, and strenuous nighttime exercise. Not only does this ruin a restful night's sleep, but it also signifies that the body's glucose levels have dropped to dangerously low levels. Monitoring blood sugar levels is essential for effectively treating night sweats, especially in the evening. It can help to identify and modify potential triggers. Additionally, medication dosages may need to be reviewed as a precaution under the supervision of a healthcare provider. In addition, having a readily available glucose source at the bedside, such as juice or glucose tablets, can be life-saving during nighttime glucose dips. 2. Nocturia. The term nocturia may not be well known, but its effects are definitely unpleasant, particularly for people who have diabetes. It denotes a higher frequency of nighttime urination. This disease is frequently brought on by elevated blood sugar levels and diabetes, as the body tries to eliminate extra glucose through urine. Regularly needing to go to the bathroom throughout the night not only throws off sleep patterns and impairs alertness during the day, but it is also a strong warning that blood sugar levels are not in the ideal range. 2 important tactics can be taken into consideration for individuals attempting to manage this nocturnal sign. First, controlling and regularly monitoring blood sugar levels, and second, being aware of fluid intake during the overnight hours. Nonetheless, it's imperative to speak with a healthcare provider if the problem continues, as nocturia may be caused by other issues. 3. Sleep apnea. The hallmark of sleep apnea is shallow or paused breathing that causes repeated awakenings during the night. For those with diabetes, it's especially troubling because sleep disturbances and low oxygen levels can exacerbate insulin resistance and impair blood sugar regulation. Obesity is a risk factor for type 2 diabetes and can also lead to sleep apnea. Changing one's lifestyle and receiving medical attention are common strategies for managing sleep apnea. Losing weight can be very helpful because it can provide instant relief from symptoms with even a slight decrease in weight. Constantly maintaining positive airway pressure CPAP machines are frequently used to maintain open airways while you sleep. Refraining from alcohol and sedatives, which can relax the muscles in the airways, might be helpful when it comes to making lifestyle adjustments. In order to avoid airway blockage, it is also advised to sleep on your side rather than your back. Because diabetes and sleep apnea are linked conditions, proper management can raise blood sugar levels and enhance general health. 4. Restless Leg Syndrome RLS. If you're finding this video useful as we go into this section, kindly subscribe to our channel. I'm grateful. A neurological disorder known as Restless Leg Syndrome is typified by an insatiable desire to move the legs and is sometimes accompanied by tingling, itching, or a crawling sensation. This pain can worsen while you're not moving about, which makes it especially uncomfortable at night. Peripheral neuropathy, a frequent consequence of persistently high blood sugar, and the prevalence of RLS have been found to be related in diabetics. In the context of diabetes, managing RLS requires a multimodal strategy. First off, keeping blood sugar levels at appropriate levels may delay the onset of neuropathy and, consequently, RLS. Furthermore, modifying one's lifestyle to include less alcohol and caffeine can help with RLS symptoms. It has been demonstrated that regular, moderate exercise helps, but too intense activity may make the symptoms worse for some. Other methods of relieving the pain include massaging the legs, using warm or cold packs, or even meditating. 5. Nighttime hypoglycemia. Hypoglycemia, or low blood sugar, is a condition that happens at night while you sleep. It's a serious issue for diabetics because it can go undiagnosed and result in problems. Night sweats, strange nightmares, or headaches upon waking up are possible symptoms. Hypoglycemia over extended periods of time might cause convulsions or even unconsciousness. For diabetics, controlling hypoglycemia at night is essential to their overall health. If blood sugar levels are low, it's important to check them frequently, especially before bed. If you eat a carbohydrate-rich snack, you can avoid a nocturnal dip. It may also be essential to promptly counteract nighttime lows by modifying the schedule or amount of insulin or other diabetes drugs under the advice of a physician. A quick-acting glucose supply, like glucose gel or pills, should be placed conveniently next to the bed. It can also save lives to inform friends and family about the symptoms of severe hypoglycemia and how to give emergency glucagon or glucose injections. 6. Nighttime frequent thirst. For many diabetics, frequent nighttime thirst is a warning indicator, especially when blood sugar levels are elevated. Elevated blood glucose levels deplete cells of water, which prompts the kidneys to generate more urine to eliminate the surplus sugar. This cycle causes frequent nighttime urination and increased thirst, which may interfere with sleep. The effective control of this symptom is linked to the overall management of diabetes. Controlling blood sugar levels is essential. It is crucial to check blood glucose levels and modify insulin or medicine dosages under the guidance of a healthcare professional. While staying hydrated is important, try distributing your fluid consumption throughout the day to avoid eating big amounts in the evening, as this might cause disturbances during the night. Reducing alcohol and caffeine intake can also be beneficial because they both function as diuretics, which increase the production of urine. It's critical to identify and treat evening thirst, since it may interfere with deep, restful sleep in addition to being an indicator of high blood sugar. 7. Nighttime cramps. It might be upsetting to get cramps at night, which are defined by abrupt, excruciating muscle contractions, usually in the legs. For those with diabetes, these cramps may be brought on by low or high blood sugar, poor circulation, or diabetic neuropathy, a nerve condition brought on by persistently high blood sugar. The first step in managing and minimizing the occurrence of cramps at night is to keep blood sugar levels steady. Keeping glucose under control can be facilitated by consistent monitoring and adherence to recommended drug schedules. Before going to bed, do some light stretching exercises, especially for your calf muscles, to release tension and lessen the chance of cramping. Preventive measures can also include wearing supportive footwear, maintaining a balanced mineral intake, and staying hydrated. Taking a warm bath or applying heating pads can help ease cramps. It's critical to speak with a healthcare professional if your cramps during the night continue or get worse in order to determine the underlying cause and get treatment recommendations. The first line of defense for successfully controlling diabetes is being aware of the symptoms. This boosts your overall diabetes management and enhances the quality of your sleep. Watch this video for other important diabetes symptoms you should be aware of. In addition, if you thought this video was useful, kindly subscribe to this channel. I appreciate you seeing.